My name is Dr. Salem. I'm a doctor of physical therapy from Brooklyn, New York. Today, I want to show you an interesting case. One of the causes of back pain is gluteal hypoactivity. Sometimes people call it gluteal amnesia. I told you before that the nerve works like a contractor and muscle fibers work like the worker for the contractor. If the contractor didn't get a job for a year or two, he will be having problem recruiting his worker. The same. This happens when the gluteal muscle, the muscle that is here, forgets how to work. You didn't give her a job for a long time. You're sitting down, just walking around in your house, don't do regular exercises, no hill climbing, no squats. That is called, sometimes we call it metaphor gluteal amnesia. This is one of the causes of back pain. So each back pain patient you get, try to check his glutes. Is it working or no? Ask him to do back extension and check if the gluteal muscle is working. The glutes are working when you do back extension from prone, from standing. If it didn't harden enough, I mean it's lazy and it's hypoactive because it didn't do a job for a while. And why is that? The muscles work in a group, like team. So the gluteal muscle here works with the multifidi, the lumbar multifidi and the lumbosacral multifidi here, and the hamstring, the three of them. If the glutes is hypoactive or lazy, the multifidi has to overwork to compensate, and hamstring as well. And this causes back pain because multifidi is overworking. That's number one. Number two, the gluteal amnesia by itself, if not treated, it can cause later on something called osteopenia, because one of the causes that calcium deposit in the bone is when a muscle pull in the bone enhances calcium deposition inside the bone, make the bone stronger. If there's no muscle pull in the bone, the calcium not only being deposited in the bone, but comes out of the bone, make the bone weaker and can cause fracture with no injury. It's called pathological fracture. So why I'm showing you here now, I'm showing you how to fix a hypoactive glutes. It's called the muscle re-education. We need to re-educate this team, the team of three, the multifidi, lumbosacral, the gluteal maximus or the glutes, and the hamstring. I need to activate the gluteus muscle. I need to inhibit the multifidi and the hamstring as well. How am I going to do that? If you want to check first, diagnose first for the multifidi is hyperactive or not, just ask the patient, imagine you're going to kick with your leg, just about to kick, but do not kick. And you palpate for the multifidi and the hamstring together. Just be hard, imagine you're going to kick, the multifidi has become so hard, like a very hard rope, like very hard. She's hyperactive, multifidi give her the back pain. Because this guy, he doesn't want to work. Ask her, think about kicking, and this glutes doesn't work at all. Still mushy, and the hamstrings now has to kick into work to compensate. So how are we going to fix this problem? It's called muscle re-education. We need to activate glutes, inhibit the hamstrings and multifidi. So what I'm going to do, look at me here guys. I'm going to tie the leg like this. I put this belt, okay, the mobilization belt. But when I tie the belt, it's like the car belt. I put it below the ASIS. I put the belt always below the ASIS. Why? Because it's going to help me. How going to help? When you put the belt below the ASIS, it increases the intraarticular pressure inside the sacroiliac joints on both sides when I do like that. And this will compensate for the weakness of a transverse abdominis as a cause of the pain. So the transverse abdominis muscle is the natural belt that comes from the spine, go around to the spine other side. It's called transverse abdominis when it works in the abdomen, and it transverse when in the thorax. Okay, when there's weakness of transverse abdominis, it can cause also back pain, can cause sacroiliac pain because of the low joint compression, low joint closing force. low intraarticular pressure, weakness of transverse abdominis. To strengthen the transverse abdominis, we need to do planks exercises from prone, from standing. I'm going to zoom the topic today. But here, what I'm going to do, put the belt first sideways. Then get a rubber band around the leg and tighten the belt, like here. Now, I'm going to ask my patient to just kick a little bit and kick with the knee up to the roof. Great. Now, this hamstring is now inhibited. And I'm teaching this guy to come up. Come up. That's good. How this works. Okay. This is based on the theory of reciprocal innervation. In order for the hamstring, to inhibit the hamstring, the quadriceps has to work. Because the quadriceps kicks into work, hamstring has to relax based on reciprocal innervation. That's why I put this leg like here. I tell the patient, kick in a little bit and get the knee up. Now quadriceps is working to rubber the band. Okay, the quadriceps is working. When the quadriceps works, try to go again. Do it speed again. Kick front. Do it. Go, 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 go. Come down. Quadriceps is working now. Here, this has to relax. Try it in. So inhibiting the hamstring by this way. Come up again. And when she kicks up, okay, this but we're re-educating now for the Gluteus Maximus to work by inhibiting the hamstring, not to help. We're going to try to inhibit the multifeed as well, and this will re-education for the lazy or hypoactive player in a team, which is Gluteus Maximus, and to inhibit the hyperactive hamstring and multifeed. And I told you this based on the reciprocal innervation. Okay, click subscribe, click like, share the video, and stay tuned. I'm going to show something new every day from my clinic. This was live from my clinic, Dr. Salem Physical Therapy from Brooklyn, New York. Bye now.